Okay, fantastic. So we're now recording. So again, this is AppShow member webinar, enabling services, installing the NextGen template. It's actually part 2 of 2. We're going to be putting in the question, in the chat box, a link to the first enabling services webinar, the part 1 of 2. That is actually now, we have it on YouTube as a video folks can watch. Just as an FYI to all of the attendees, you are in listen-only mode, but we will be doing a Q&A at the end. If you want to either type your questions into the question box or into the chat, we'll be sure and either answer them as it makes sense for the different presentations or address them at the end. I will let you know a lot of times the questions are often about things that are either about to come up, and so usually that's often about to be addressed, or we can look at the list of questions and make sure that those are addressed in the Q&A. So feel free, again, if you have any questions, if you have any specific things you need, definitely let me know. And you can also do a hand raise. So there should be a little hand in one of the things on your little GoToWebinar control panel. So you can raise that and we can make sure and call on you for specific questions. So next I'm going to go over our agenda. So our agenda today, we're going to do an overview of the Enabling Services ES project and some of the current work by Kristen at Health Outreach Partners. And then Chrissy at Waianae Coast Comprehensive Health Center is actually going to give a template demonstration on how enabling services can be collected and recorded in the NextGen EHR, EMR, as well as Chrissy's going to do some troubleshooting on that. We're going to end with some Q&A and next steps. I'm going to move to Kristen. One note is that because this is a part 2 of 2, if you find yourself lost or there's items that you missed from the first half, feel free to listen to this, take notes and everything. And again, we will be sharing the YouTube link for part 1 presently. So any questions or chat bits before I move on? Okay, so hearing none, I'm going to pass this to Kristen.
Great. Thanks, Heather. And you'll click through my slides for me, right?
Yep, definitely.
Wonderful. Okay, so why don't you go to the intro slide. I'm Kristen Steimanoff. I'm Deputy Director at Health Outreach Partners, and I've had the privilege of working with my colleagues at AppShow and the National Healthcare for the Homeless Council for the past 4 years on this project. You can see the logo and the mission for each of our 3 national partner organizations on the screen. We're all national cooperative agreements, and we get some of our funding from HRSA, the Health Resources and Services Administration, Bureau of Primary Health Care, to support health center program grantees. We've been collaborating since 2012 to make this enabling services data collection training, to first of all develop a training of trainers and then make it available as widely as possible to HRSA health center program grantees. We've delivered it all over the country, and we've been working the past year on updating the protocol based on actual utilization and current realities, and I'll talk about that a little bit more in just a couple of minutes. But we're hosting these webinars, the webinar today and the first one on June 8th, to give participants the chance to see how their peers are really taking full advantage of their own EHR to make their enabling services data come to life. So many of you who are on the webinar today were likely on the webinar in early June. If you weren't, you can see the link in the second bullet. I have the link to the webinar there. If you can't click on it and access it there, we'll also paste it into the chat box and make sure you get access to that. But overall, the purpose is to show how to install templates specifically in NextGen to allow for good tracking and reporting of enabling services activity. We did more of an overview during the first webinar, and today we'll take a deeper dive Michelle Chrissy from Waianae Coast Comprehensive Health Center is here to walk us through this. And it was so valuable last time. I know it's going to be equally valuable this time, and we'll have lots of opportunity for discussion as we did in June. So let's go to the next slide, Heather. Just a quick refresher on enabling services, so we're all on the same page. They are non-clinical services that aim to increase access to healthcare and improve health outcomes. So health centers, as you know, provide a whole host of enabling services that help patients access the full range of healthcare and social services that they need. They include case management, health education, interpretation, transportation, outreach, eligibility assistance, and civil legal aid. Lots of different enabling services. But there is currently incomplete data to show that breadth of services. I'm sure everybody on this webinar is familiar with the Uniform Data System, the UDS. It's the system through which all of the health centers have to report key data, including patient demographics and utilization patterns, staffing and costs. And if you're so familiar with the UDS that you actually know about the specific tables, Table 5 is all about staffing and utilization. And if you are looking at Table 5, you would notice there is a place to list the number of FTEs, the number of full-time staff members you have who provide enabling services in the categories of case manager, patient and community education specialist, outreach workers, transportation staff, eligibility assistance workers, interpretation staff, and there's a place to note an other type of enabling services staff. But clinic visits, health center visits for enabling services are only counted for 2 of those types of staff, for case managers and for patient and community education specialists. So there are lots of enabling services that are being provided that aren't being reported at all in the UDS. So we have this very partial picture of what's actually going on in health centers, and nowhere do folks have the opportunity to actually report on the amount of time they spend doing this work. So let's look at the next slide. This is something that APCHO has been working on for a very long time. They initiated a pilot project in 2004, and there were 4 participating health centers. Waianae Coast Comprehensive Health Center, which is the 4th one on the list, is on the call with us today to share the work that they're doing. But there were also health centers in New York, Charles B. Wang Community Health Center, Seattle, the International Community Health Services, and Kalihi Palama Health Center in Honolulu. So those 4 health centers were part of that original pilot project. And the purpose was to develop a standardized data collection model for enabling services. And because I'm just doing a real brief overview today, I'll just quickly remind you that, that in that study of those 4 initial pilot sites, associations were found between higher utilization of enabling services and better diabetes outcomes and more appropriate childhood immunizations. There was also a demonstrated link between higher investment by health centers in enabling services and better health outcomes in their patients, more childhood immunizations, more PAP tests on the correct schedule, healthy birth weights, blood pressure, and healthy hemoglobin A1C levels. So lots of positive associations between utilization of enabling services and expenditure by health centers around enabling services. Next slide, please. So you're doing this very important work. It has important results for your patients, and so we're really trying to help people understand the value of going the extra mile to collect and use this data for decision making. You can also use it to advocate for sustainable funding, to bring attention to the need for comprehensive services, both internally in your organization and externally to funders. And it really does help allocate time and resources more effectively if you see that a lot more time than you may have realized is being spent, for example, interpreting for patients with an emerging language group, for example. And it definitely supports efforts to get PCMH certification and to rise up through the ranks of those levels and other payment reform efforts. Next slide. So as I mentioned at the beginning, one of the projects that we've been working on recently over the past year, the 3 national partners, is focusing on refining the definitions to make sure that they best meet the real experiences of frontline staff who are doing and enabling services and reporting this data. So we've had extensive input from an advisory panel made up of health center staff who've been using the original protocol, and they've given us a lot of really important information about what works well for them and what they would like to see differently. Some of the categories that were in the original protocol have been broken down further than they originally were. So on the screen, for example, you can see there's a case management section, but there's also a referral for medical and a referral for social services. Those were not there before. It was just one case management referral category. There's also a social services assessment to really reflect the fact that a lot of broad assessment that is non-medical is going on, and we wanted to reflect that. Health education has been broken out officially into individual, small group, and large group. And as you'll see on the next slide, supportive counseling has been given its own category. In-reach has been added, and transportation has been expanded to reflect medical transportation and social services transportation. So as I say, we got lots of input from an advisory panel of folks who are actually doing this on the ground, but we absolutely want to do our due diligence and make sure that these definitions really reflect the needs of health centers. And so we'd love to test them out. I'm just going to make a really quick plug for a testing committee or beta test group that we're trying to assemble right now. Folks who are interested in testing out these new definitions with us will receive some benefits. You would get a refresher training on enabling services for frontline staff. You'd get assistance during the month of testing on the new definition, so you would get one-on-one support there, and opportunities to participate in peer learning sessions along the way. So we're going to open this up to anybody who participated on our advisory panel and anyone who's participated in our trainings so far. So definitely let us know if you might be interested in testing out these new definitions with us. But I want to not delay any further and turn it over to Chrissy at Waianae Coast Comprehensive Health Center, because she has very good detailed information to share with you about how to do all this in NextGen.
Wonderful. Thanks so much, Kristen. So definitely we're going to move right along to the NextGen Enabling Services template demonstration and troubleshooting. But if folks have any questions about the broader enabling services work, please definitely let us know either in the chat or the questions. We can follow up with you. We are definitely looking for people for this beta testing committee to help make sure that these are the right definitions and everything like that as we finalize those. So if you're interested also, please let us know. And we'll also have our information on the last slide. So Chrissy, I'm going to pass this over to you. So we'd actually change
okay.
Enter. 1 second.
Are we on a negative timeline? How much time do we have? Okay. Can you see my screen, Heather?
Yep, go for it.
Okay. So good morning, everyone. My name is Michelle Christy Kohine, and I'll put that in just because my email says Michelle. Most folks refer to me here at Waianae as Christy, so just not to cause confusion. One and the same. And then also, so 2 things before I get started. I do want to introduce Lena Ala Kanana. She's on the call today. She's our Director of Community Health Services. and I invited her to participate as needed for any kind of workflow questions. So from part one, we had a few questions about, who here at Waianae is actually using the template, how do they use it, when do they use it, and so from the technical side, I can answer those kind of questions, but I don't use the template in the field, so Lena is our expert in that area. So when we get to the Q&A, just wanted to let you know that she will be available to respond to those kinds of questions. The second thing is just kind of a recommendation. I always find that it's kind of helpful as you're going through a demonstration / kind of sort of a training that if you have the ability to have some kind of hands-on opportunity, that always is kind of helpful to help with really understanding what needs to be set up, or at least to get an idea of what it looks like in your database. So certainly don't take a whole lot of time, but if you happen to have easy access to your own test database at your organization, my suggestion is have it open up, off to the side. As we go through this, you can kind of open up, for example, your file maintenance, check out where things can be set up. And again, in your test database, not in production. And then I think that way it can also help to spark any kind of questions that might come up. And then you can go ahead and put that in the chat and we'll respond to that at the end. So we'll go ahead and get started. Really, my slides, I'm going to be going back and forth between our test database and the slides here. But what we're going to do is we'll start off with, before we talk about importing, I just really wanted to quickly show where in NextGen you can find the CPP code. So really what will happen is, besides importing that enabling template, you're going to need to have some setup done ahead of time, or you'll run into template errors when you try to start testing the template. So once you have this set up, this will actually kind of resolve some of those things. So first thing is you want to be able to add a no-bill procedure code that you can then associate with a service item in your library. So where that is in NextGen is if you go to your file maintenance, and again, that's just on this screen here, you'll see file maintenance, and I've already opened up some things just to kind of save us some time. And then if you click on EHR, you're going to see your CPT4 codes. And what we've done, and really, again, this is a custom workflow. There's nothing in NextGen instruction manual that talks about this. And so we set this up about 14 years ago. And so it's really kind of just trial and error. The group got together and how this was going to best work for reporting, and then make sure that we didn't inadvertently send billing to our payers and those kind of things. So we did initially was create an actual CPT called no bill or NBIL. So this is what it looks like if you were to set it up. So the code and then the description. So that's your first step. Okay. And then the next step, if we go back to our slide, is we want to then associate that no bill. So you can associate multiple CPT4, associate that one CPT4 code with multiple service items. Okay, so when we're going to go ahead and look back at file maintenance, and in your service item library, and that's all this is here. So we're back at file maintenance in libraries, service items. I'm just going to go ahead and click on that. I think for most organizations, you probably have your own kind of custom one that you've set up that includes all of the CPT procedure codes that you use for your organization, and any custom ones, like for example, the ones that we use. So this is where you would end up setting it up. I'm just going to go ahead and type in a beginning of a transportation code. So this is the transportation code. You set up your, go ahead and select that CPT4 code here. So that brings up that same box. So you'll see why you have to have that set up first before you can create that service item. So this is where you would end up entering in all of your enabling services codes. Some things to notice here that you'd want to suppress it from that patient procedure, and then you see some prevent charge amount overrides. Okay. The next thing is you'll want to link, and in our case, we wanted to make sure that the provider that our users selected was one that we didn't, or the system, in the workflow process didn't inadvertently send claims to peers. And so how we did that was we went ahead and used our medical director and then just added in middle name. So at a glance, so it displays as on the right-hand side, Stephen Bradley enabling. And then I'm going to just show you how that looks in the provider master. So again, we're still at file maintenance. I'm going to go ahead and select EHR, and then I'm going to go to our providers table. So for those of you that work in NextGen, this should look very familiar to you. I'm going to go ahead and select our enabling Dr. Bradley. And if you notice, the one thing though that you'll need to kind of just give up, I mean, because there's really not a lot that you can do about that, is you'll have to give up one of your EMR and EPM licenses to that enabling provider. So although you're not billing, using that provider for any claims, the hope is that as you're tracking your enabling services that you provide, that you can then, your kind of benefit to that is bringing it to pairs, showing them the kinds of things that you do, and then hopefully when you negotiate with them, you can come up with a higher pay rate for your visit. So that's our thinking. So we set it up here in the system. We went ahead and assigned a primary location of case management for that for an enabling provider. The NPI, I think this ends up just being like our organization code, but you certainly do not need to have that. I double checked with our billing person. This is where you would end up assigning your licenses, so your EMR and your EPM, and then you have to make your enabling provider rendering at your practice. Okay, so that's where you would do that. Again, file maintenance, and then your provider master. Okay, so once you have that set up, then you can go ahead, and this link here is will be available on the side. You can also go ahead and write it down. So this is available now. I'm going to go ahead and just open that. And where that will take you is to our enabling services site. The first thing you'll be presented with is our EULA, so you'll need to go ahead and read through that. There we go. So you can go ahead and read through that. And at the very bottom, and pretty much what this is saying is that we've created a custom template. By no means NextGen is, because they didn't create it and it's not part of their template knowledge base, that they're not going to provide any support for it. And that you are going to put it into your test database to make sure that you do your testing first, your due diligence there. And that's it. Once you go ahead and redo and accept that, you'll go ahead and get prompted with save, an open or save. So what you'll want to do is you'll want to save this zip file somewhere where you're going to be able to get it when you're ready to import the template. So in my case, I mean, really you can just save it anywhere. Just make sure you have access to it. You can save it into, if you know where your test database is and where you typically save your exported templates, those that are ready to be imported into your database, and you can go ahead and certainly save it there. I just went ahead and saved a copy into my what we call a Y drive. Okay. So I did that early on. The next thing that you're going to do is you're going to go ahead and extract those contents. So what you're going to download is actually a zip file. So you're going to have to extract that information. And let me see. I know I have it here. Okay, so it'll look like that, and the icon itself looks like it has a little zipper on the folder, so you'll know. So I'm just going to go ahead and right-click, and I'm going to go ahead and extract all. Okay, and the destination is going to just stay. I'm going to keep it just in that Y drive. So I already have it here, and it's asking if I want to go ahead and just overwrite it. So I'm going to say no. So once you extract it, you're going to end up with a folder, a regular folder that doesn't have the zipper on it. If you double-click, you'll have a copy of that EULA. There's also some README information, but the 3 templates that you're going to want to import into your database is your main template, which is this clinic enabling encounter. So we'll go ahead and look at that today. And then we have 2 pop-ups if you're interested in using the 2 pop-ups. One is a health education pop-up, and when we look at that, you'll notice that the codes we have there, the enabling codes, those are internal codes that so beyond what Actual has created, we went ahead and created kind of more detailed ones, and we'll look at that, like health education. We actually early on went ahead and kind of separated that out into more detailed type services. you'll know what our codes are, our custom codes, because they start with the letter X. Okay, so you're going to end up importing the 3 templates. It's not to say that you have to use the 2 pop-ups if you don't want to. Okay, to import that, all you're going to do is you're going to go back to your NextGen main screen, and there's a utility called Template Import Export. Okay, so I've already brought that up here. So you should be able to see this NextGen Template Import Export. If you work with this tool, then you want to always just make sure that your path is already enabled. So if I just go ahead and reset, this logging path is really just for the log. If you don't set it, all it's going to do is you'll have to go through these messages saying it can't log the activity that's occurring. So what we do is we just go ahead and we save that particular log of the activity in our EMR department folder. Now on that import tab, what you'll want to do is you're going to want to go ahead and leave this checkbox. You won't have anything in your database, but this is a default, so you don't need to unselect that. What you do want to select is your include stored procedures. There is one stored procedure associated with the template, and what that does, that stored procedure does is it creates a database pick list of particular users. And I'll show you that and why that might be helpful for you. There's some setup in the provider master for that. But when Kristen talked about reporting and tracking your resources, this is where you can kind of really get really detailed down to really what person is providing the service. So not only whether or not that person is a care coordinator or a case manager, but who actually provided the service and what types of services. And so that third procedure will let you document that in the template. You want to copy background and image files. And other than that, for your first 3 top checkboxes, the default include pick list, that's always going to be there. And so we're okay with that. I'm going to hit OK. You're going to go ahead and hit load files, and you're going to go and look for that folder where you save that template. Let me just move this over. So in our case, I went ahead and I just opened it into my OneDrive. And so that's here, that enabling services template. And then all it's going to present to you are the 3 things that you can go ahead and import. So I'm going to go ahead and select them all, and I just did the shift. And I'm going to go ahead and hit open. And then they'll be in this section here, ready for you to import. Okay, so once I hit import, and then I just want to make sure that I'm importing it into, so you see at the top again, I like to always double check NextGen test KBM. I'm going to go ahead and import it. It's going to go through its process. It'll let you know if it's successful. So green is always a good thing. Red, if it's red, then there's some kind of error that you're going to need to resolve. I don't anticipate, though. I haven't had any calls on anyone having a problem with importing the template. Okay. Let's see. So next thing is we're going to go and check it out. So back again on your NextGen main screen, you're going to go into Template Editor. So this is the tool that you're going to use to go ahead and view what we call the back end of the template. So this is not something that your end user or your frontline people, whoever's going to use the template, won't be looking at this. It'll be your technical person, whoever works on modifying, customizing, or troubleshooting any of your NextGen templates. When I hit Template Editor, then you'll have a screen that comes up. What we're going to do is we're going to go ahead and look for that template. I already have it saved from a previous view, so you can go to File here, or to search for it initially, you're going to have to look for it in your template screen. And so remember the download name of it started off with WCCHD, and it's called Clinic Enabling. So that's actually the template that you're going to have to look for, is that name. So I'm going to go ahead and open that up. Now what you'll want to do at this point is you're going to want to copy and rename the template and the pop-ups to make it specific to your own organization. And then that way you'll be able to find it easily as well. And then if you have to create any new templates, it'll be specific to your organization. So really all you need to do for that is just a file copy template. When the screen comes up, you're just going to rename it like you would just in any other file. So NextGen always recommends if you're doing a customizing or modifying of their template, that you start your template name off with your organization acronym or something that's going to be specific to your organization. So you'll notice too in my screen that we have all of our templates start off with WCCHD. I think one of the great things that NextGen did a few years back was they also gave us the ability to change the display name. So in the back end, you can have it. So in our case, we have it as WCHD underscore and then whatever the template is. And then the display name is going to be something that is, number one, you'll take the WCCH off. You probably want to have it at a glance where you're, think about your end user, your frontline people, the people who are going to use it, what will make it easiest for them. So what we do here is we start off with is just a little space. I tapped my space bar on my keyboard, and then we went ahead and made it exactly what it is so that when people look for it, they're going to want to look for a Connect enabling template and just to make it easy for them. Once you do that, and then we also we end up adding our WCCHD at the end, just so that end users know that they're also using the right template. Okay? And then that's that display name. So it doesn't change the backend table. So when you're doing reporting and those kind of things, you're not going to report off of the display name. You're going to go ahead and report off of the actual table name. Okay? So that's the first thing that you're going to want to do. So that was our copy and rename our template. Same for the pop-ups. And again, those pop-ups, you'll search for it the same way you did for your template, the WCCHD underscore and then clinic and whatever the name of that was. So let's go ahead and open up that template, which I did here. Some things that you're going to notice is, well, first you want to make sure that it actually exists. And then it opened up in Template Editor without any problems. So let's go ahead and open it up in the front end. So this is where the interface that your users are looking at as they're going through their patient visit. So I've already opened up a test patient here. And again, I'm in our test database. And I've created a visit for today. So in terms of workflow, we can go ahead and look back at that and why, you know, why we start off with a master and those kind of things. But just from a technical perspective, I always like to open up as soon as you import something in, you want to make sure that it opens up. So number one, that you can find it. Right, so in our case, I've added it to my preferred list, but we know that we've named it with that space and then the C. So if I go into our show all, we'll see that it's here. So I went ahead and opened it, and this is our template and opened up without any issue. If you start at the top, one of the things to keep in mind is this is our very kind of our one and only version. We haven't done any updates to it. So this is back in 2011. So one of the things that you will need to update on your end will be the ICD-9. So now we're in ICD-10 from last year. So you notice we have a default here that defaults to the ICD-9. In our production database, we already have it updated. But I can show you how easy it is to just update that trigger. And so some other default things is we are there PCP, and that comes just from what you have on your but I think I have a trigger that actually populates based on what you have in your EPM. You could certainly change that field out and just leave your regular PCP information in there. That's certainly up to you. I think we went ahead and set that up way back when. So the other thing that auto-populates is the place of service. You can certainly change that, or if it's not something that you really need to keep track of, you may not even need to use that. Okay. So we opened up our template. We saw some of our defaults. Some of the other things that we're going to look at now in the back end will just be some well, one in particular, one field that we created. It's a master and template field. And then for those of you that are familiar with NextGen, master and kind of is that table anyway, is used, utilized throughout the database and throughout the workflow. So just to keep in mind that we created this template a long time ago. So a long time ago meaning before the NextGen lockdown. So there was a time, believe it or not, that NextGen didn't have a lock on their template. So we would go in and we could copy and modify the template. Thus, this master and current provider field is something that we've created, and this is where I'm going to show you that stored procedure. So when we did the import and we checked off include stored procedures, I'll show you that stored procedure and how that works for creating the seen by provider list. Okay. And then just let me make sure that that's where I'm at. Okay, so before we move on to the errors, what I want to show you for that DB pick list stored procedure, it's in this patient seen by field. If I go ahead and click on triggers, all I did was a right click and a sub-menu comes up. I'm going to go ahead and click on my trigger field. And if I click in this DB pick list, it shows that it's a stored procedure. And then all that means is in your database, so if any of you are familiar with working in Template Editor, setting up your stored procedures, this SQL Server Management Studio should look familiar. This is the database that we're currently working in, right? So our NextGen Test KVM, we know that because if I look back here down to here at File Maintenance, it's that NextGen Test KVM. So what I'm looking for now that I want to just show you real quickly is that stored procedure. So NextGen already has a bunch of stored procedures that run a lot of the ways their knowledge base works, right? So your template workflow, things open up because of these stored procedures, or things populate or prompt you. So all the stored procedures that we've created, again, like in our nomenclature for the template side, we go ahead and we start off the naming convention of that stored procedure with WCCHD, so it's easily identifiable. And then also to keep in mind, whenever you do your upgrades, you don't want, if you name your stored procedure or you modify one of NextGen stored procedures, it's going to get overwritten. So you want to make sure to keep that in mind when customizing any of NextGen's or creating your own. So all I'm going to do is I just want to just show you real quick. It's really just a stored procedure that creates that pick list for you. And the way that we set it up is that it'll recognize how we set up that person in our provider table. So if they're provider type 1 indicator, I'm going to show you that. So that field name, all that says is, now I'm back in file maintenance. This should look familiar. We're in the provider screen. I'm going to go ahead and select one of our, so now when I'm referring to provider, I'm referring to a provider of an enabling service. So someone like a health educator or a case manager, care coordinator. So I'm going to look up one of our folks, and I know she won't mind. Okay. So first thing for that particular provider or that the person who's going to be providing that enabling service, where you really want to be able to track that particular person and the types of services they provide, you're going to have to add them into the provider table. You're going to have to mark them rendering, and I'll show you why we decided to mark them rendering, and that goes along with the report. So in the provider type tab, and I'm going to just kind of just shuffle real quick back to that SQL. So remember I was saying that the way that this stored procedure works for creating that pick list is it's going to look at what we have set up for that person in the provider type 1. That's that number 1. So all that is this. So in the provider type, we went ahead and selected this person to have a 1 status. So whoever you have set up in your provider table who have that number 1 selected, they're going to appear in that DB pick list. So if we look here, and it's we have it sorted by first name. I think it was just easier, people know each other by their first name more than they do their last name. So you'll see 2C is here. Okay. So at this point, if we in our workflow, we go ahead and 2C would go ahead and select her name as a person that is seeing the patient or providing that enabling service. And just real quick, the other part of that workflow, when we talk about why we selected that person as a rendering, is they go ahead, and this is again for reporting purposes, our report actually looks at that rendering. They'll go ahead and change the rendering to themselves. So I'm going to just go ahead and choose 2C here. And this is by last name. Okay. So I'll refresh that. So you know that the rendering is our case our community health record, but then the provider at the top who's assigned the license to is going to remain that Stephen Bradley. So we don't assign actual licenses to the non-medical providers or the providers that we're not billing visits for, actual billing to peers. So this is the procedure. Again, this is something that you're going to find then in your database. That's why I wanted to show it to you. When you select that checkbox, it gets inserted into your database. Whether or not you use it, that's certainly up to you. If you decide not to, it's really just a matter of you can go ahead and just easily hide that field. So when you double click it, you just go ahead and select hidden, and that goes the same really for any of these fields. So, you know, place of service, getting down to whether it's office or other, if that's not something that is applicable to your workflow, you can go ahead and just hide that field. So it's certainly customizable. Errors that may exist would be, and I don't know if I unhid this one. Let me just double check. So one of the main errors would be the when you hit your Submit to Superbill button. So that button, all that does is it sends the services that you say you've provided, and you hit Submit to Superbill, it sends it over to your procedure module. One of the, I think the most common calls that I get for errors would be that it can't add that patient procedure. And all that means is that, remember in the beginning when we set up the service item in our file maintenance, that service item just doesn't exist, so it can't add it. That's all that means. Okay. Another error that you will experience, and I'm going to leave it up to you to decide if you want to resolve it, either really just by disabling that trigger or hiding that field. And all I did was, these little eyes are just informational icons. All that means is you're going to click on it. There's no functionality to it. It doesn't do anything except provide your user with more information, in our case with more information on those particular services. So the definitions we have here are things that we've come up with that we felt help the user to know what exactly that service is, so they know they're clicking on the right thing. So what will happen is, because if you remember now, we only imported this main template, and then we imported these pop-ups, right? So this health education, and then interpreter services. So when you open this up and you go to click on the eye, it's going to give you an error message, you know, it doesn't exist, or actually nothing may happen. So if you're interested in any of these informational pop-ups so that you don't have to create them on your own, I can certainly email them to you, or I can show you how to easily create these little info pop-ups on your own as well. Okay, so those are the two most common ones. Again, and you'll know, because I think one of the things, if you work a lot with the templates and in template editor, the first thing that I always kind of look at is over here in this menu bar on the side here on the right hand side. If you see things, and if you're familiar again with the NextGen database, you'll know really what is NextGen. So, you know, these person tables, these are things that we don't, that you don't edit. And then sharing them on here are, you can always share these to any templates. There's no editing or inserting or updating that kind of happens on these fields. It's more the information is just going to populate. And then all of these are custom. So what's great about that is then it really decreases or almost even eliminates any kind of error or interaction with the NextGen tables. Let's see, make sure I'm on track. Okay, time check, 10 minutes. So entering it in EMRs, entering it in EHR. So I did show you the rendering, so we went over that. Let me just show you very quickly how that works for, I did want to show you, sorry, one more thing on the diagnosis. So when you want to look, if you notice that ICD-9 defaulted, all you're going to need to do is I went ahead and clicked this trigger gear thing at the top. And then that way you'll find where those triggers are. It's just, the action is just an assigned field value. So in this case, you're just going to look at where that particular defaulted message pops up. I think it's easier to look through this than to actually find the field itself where it exists, because sometimes you don't remember. So I know it's here. I know that there's 3 triggers. I know because they're saying assign counseling, not otherwise specified. So that's where you would go ahead and just change your code here. And I think it's like a Z something. But you would just go ahead and change whatever the ICD-10 code, and it may be a different code that you want to have populate all together, or you may not want to have anything default there. So that's easy enough to change. In terms of workflow, say for example, we just went ahead and did the CM referral. You'll notice what we talked about in part 1, I talked a little bit about units of time. This is where you're going to have to just add in your pick list. And then in the NextGen world, because there's really no way to send that to the procedure module 10 minutes, we went ahead and just made 10 minutes equal to 1. So like 1 unit, 20 minutes is 2 units. So you know that the way you set it up, what that 1 unit represents. Whether or not it was in person, compliant patients. So again, these are the things that I don't really know too much about. I'm just going to go ahead and click them. And then at this point, I'm going to hit submit to Superbill. You see it's running those procedure triggers, adding that new procedure. So I'm going to check this out. This is the EMR procedure module. So today is August 3rd, and we selected 3 things. So these are the 3 things. And so you'll see here, it says the Z7019. So NextGen has it already embedded into their system to recognize those legacy codes. So when I try to submit the 9 because it's defaulted, the system automatically finds if there is that 1-to-1 crosswalk. They'll go ahead and just assign that ICD-10. But you definitely want to change it on the template trigger side. Okay, so that's there. So again, all we did was submit to Superbill. And remember, this it's only staying here though. It's not going to get billed or go anywhere on the practice management side. Now for entering EPM charges, I'm not going to spend a whole lot of time except that I'm just going to show you what it looks like. So when would you use this for transportation? We decided transportation really doesn't need to be in the patient's medical record for any reason, but we definitely wanted to be able to track the services that they provide. So they use the appointment scheduling book to schedule patients, and then they go in manually and create a charge in that. Once they create the encounter, they go ahead and create that charge. And let me just make that a little bit bigger so you can see. So one of the things that we went ahead and added, besides that regular, the actual transportation code, that TR001, we went ahead and created an internal code at X5006 to track the mileage. So that might be something. So if you notice again that, well, you don't see it in this one, but if I were to click that top one in real time, the quantity instead of 1 would be 3. So it would be 3 miles is what it's representing. So just some things that you can go ahead and start to think about in terms of adding into your workflow and the kind of information that you want to capture. Okay. For NextGen reporting, we talked about that. Again, it's whatever you put on the EPM side. So in this case, it's going to be transportation. So the things that we went ahead and entered in the EMR procedure side, you're going to have to use a different tool, which we call SQL, which we use as SQL service reporting services. Anything that you enter in, so like these transaction codes in EPM or charges, you can go ahead and create a charge report for that particular service. If we have time in the Q&A, if anybody wants to see that, I can go ahead and open that up. I just don't have it opened up right now. I do want to show you though the ES reporting in SQL Server reporting services. Okay. So the way that this works is this is the SQL, by the way, and you're feel free for anyone who wants to use it or use it as a starting point, instead of having to start from scratch. This is the SQL report query that we use. So then when you open up your report, there are parameters that we set up for searching by the provider of service. So again, this could be a case coordinator, and again, so this field pulls from that rendering that rendering service provider is where that report. Sorry, we have some visitors here. Anyway, so that's where that's why that's important. If you want to be able to pull a report that's detailed, then you're going to need to think about how that works or what fields you want to pull from. And really, this is the only thing that we've come up with. So I'm looking at the time. I want to make sure that we have some time for Q&A, and I can certainly do any kind of follow-up email in that case. But Heather, I'm not my question slide, so I'm going to send it back over to you.
Okay, wonderful. Thank you so much, Chrissy. This is extremely useful. And that was an extremely useful overview of all the different how to use kind of the back end of some of this work, as well as working on some troubleshooting. So I'm going to put up the slide that has links to the ES template and our emails, and then we're going to kind of open the line a little bit and allow folks to ask some questions. So putting this back here. There we go. That should be there. Wonderful. You guys see the links and everything like that here?
Mm-hmm.
Okay, wonderful. So here's our email addresses down here. In the interest of time, I'm going to start with some of the questions from the question box. And just again to confirm, I will be, there is a link in the chat for part 1, and we will be posting this, a link to this on the YouTube. So the first question in the question box for SIM setup, depending on if it is a case management visit that can be counted on UDS, would you set the SIM code to be a qualifying visit? So Mary de Arkland, does that make sense, or do we want to get some more information?
I'm not sure I can answer that one. I don't know if Lena can. That might have to be, we have another person who does the reporting. Yeah, I'm not sure. Lena, do you know?
I'm not sure. I'm not familiar with case management encounters on the UDS one. That would probably internally for us that most likely be Verna to answer that question.
Yeah, that's what I was thinking. So we could go ahead and if you could, if I could have that, what I can do is make sure the person who can answer it, I can forward that and then make sure we get a response there.
Okay, sounds good. So Mary, if you want to go ahead and take down one of the our emails on the screen and follow up, we'll be sure and connect you with the person who can answer that question. So I'm going to go down some of these questions, and then Sherry Daniels, Papa Ololokai, was wondering what's the cost for the license, and I'm assuming that's the cost for the NextGen license.
Yeah, so the NextGen license, it depends. What we normally do is we try to purchase them when they have their specials. So that's typically towards the end of the year, or like in our case, I think we were on EHR for 14 years, but EPM only since 2013. So we had a special. I think they give you like a 2 or 3 years where you get a percentage off of anything you buy, but it's certainly less expensive to bundle. So I want to say in general, I think it is kind of like it's probably close to about 10,000. Just without any kind of discount. So that was really, believe me, we kind of talked that back and forth, if they're going to be worth it. But really, at the end of the day, that was the only way that we could really get some really good reporting. And I think it serves its purpose in terms of, and we've had really great conversations with payers. We have payers who have, increased what they pay us for services because we are able to prove them. It's not, you can't only just say we do these kind of things right. You have to be able to have a way to prove, number one, that you're collecting them, and then what are the outcomes, and they're providing these quality outcomes. So.
Okay, that looks like the extent of the questions in the question box. And just to confirm some of these questions, we're definitely going to be sending out a link to the video once the recording is done and we put it up on YouTube. And then if you look in the chat as well as on the screen, there's the recording available for the part 1 webinar. So we'll be sending those around. So one last question from Teresa, is patient services the same as insurance eligibility in EPM? I'm not sure what you're referring to with the patient services specifically, but if it's one of the enabling services for insurance eligibility, that's actually one of the specific enabling services. So I think that's about it. Are there any other questions?
And then again, Heather, I mean, I know that was a lot. I tried, I fit in a lot of things in like 35 minutes. So really, I'm very open to receiving any kind of emails. And I'll just say ahead of time, I mean, I have other projects going on, but so give me just a little bit of time to respond. And again, if it's not something that I know about, I can definitely find a resource that can help us answer your question and kind of get you, moving in the right direction. It's certainly been helpful for us to utilize the enabling services and find a way to work it into our EMR workflow. So.
Wonderful. Thanks so much. I mean, I know that we definitely actually really appreciate having someone from our health centers who has all this background information and knowledge and is really able to explain this in a really digestible way. So thank you so much. So just answer one more question in the chat boxes. We do have the emails of everybody who RSVP'd to the webinar, as well as then we can tell who then signed in. So we will be following up directly with those. With all of you guys via email with a link to this recording, as well as just a link to the previous recording if that's useful as well. So again, hearing no more questions, I want to say a huge thank you to Chrissy Michelle and Kristen and Leana Alla, all the folks at YNI and Outreach Partners. Really, really thankful that we're able to be on the phone and give us a great, amazing background on some of this amazing work. So thanks, everybody.
All right.
Thank you, Christine.
Thank you.
Aloha.
Aloha.
Bye-bye.
Bye-bye.